Today I'm going to explain exactly how arteries get clogged. Not the old cholesterol just builds up in your arteries story, but what really happens inside the body, step by step. We'll go from the very first injury inside the artery wall to how it develops into soft plaque, then calcified plaque, and then finally the clot that actually causes the heart attack or stroke. This is real pathophysiology of atherosclerosis. And as a physical therapist, I see the end result of this every day: strokes, amputations, heart failure, poor wound healing, and peripheral artery disease. Most people think cholesterol is the cause, but cholesterol is not the beginning of the problem. It's the band-aid. The process actually starts with damage to the inner lining of the artery, called the endothelium. This damage can begin years, even decades, before someone ever has symptoms. In a healthy artery, that endothelium, the innermost layer of the artery, is smooth, almost like Teflon. Blood flows through it effortlessly. It also produces nitric oxide, which keeps the artery relaxed, flexible, and it gives it the ability to dilate when we need more blood flow and constrict when we don't. This flexibility is essential for normal blood pressure and blood flow. But that lining gets damaged by things like high blood sugar, high insulin, high blood pressure, smoking, chronic inflammation, and even stress. All of these can cause oxidative stress and create tiny microscopic injuries in the endothelium. And once that surface is damaged, it's no longer smooth. It becomes sticky like Velcro. And that's when cholesterol, immune cells, and inflammation start to kick in. All right, let's talk about the villain everybody thinks. LDL cholesterol doesn't just randomly clog arteries, it slips underneath the damaged endothelium. Once it gets stuck in there, it can get oxidized, and oxidized LDL is what triggers your immune system. White blood cells called monocytes move into the arterial wall, transform into macrophages, and try to clean up the oxidized LDL. But as they engulf the LDLs, they turn into what are called foam cells. Foam cells are the beginning of what's known as a fatty streak, the very first stage of plaque inside the artery. Most people don't feel anything at this point. This can happen silently, even in our teens and 20s. Over time, more lipids, more immune cells, and more inflammation build up. The artery tries to protect itself by forming a fibrous cap, kind of like scar tissue, over the area. And that's where plaque becomes more complex. There are two main types: soft plaque and calcified plaque. Soft plaque is more dangerous, it's inflamed, unstable, and more likely to rupture. Calcified plaque is hardened and more stable, but it stiffens the arterial wall and reduces flexibility. But here's the key point: most people don't die because their artery slowly narrowed. They die because a soft plaque ruptures. And when that thin fibrous cap breaks open, the body thinks the artery is bleeding. So all of a sudden, platelets rush to form a clot, and that clot can completely block blood flow. It happens in the heart. That's myocardial infarction or heart attack. If it happens in the brain, that's a stroke. So when the blockage is only partial, some blood can still get through. In the heart, that causes angina, chest pain when you're exercising or stressed. In the brain, it can cause a TIA, a transient ischemic attack, or a mini stroke. And in the legs, it's called claudication, pain when with walking because the muscles aren't getting enough blood flow. But if an artery becomes fully blocked and tissue dies, that's when we see heart muscle death, brain damage, kidney failure, or dead tissue in the feet and toes. Now here's something important. Diabetics and people with insulin resistance don't usually have one clean blockage in one artery. They have diffuse multivessel disease, meaning plaque is forming in multiple arteries at the same time. In the heart, that often means stents don't work. They need to have full bypass surgery. In the legs, they sometimes need a femoral popliteal bypass. That's where they take the femoral vein and use it to bypass from the femoral artery down to the lower arteries to get blood to the feet. This is why diabetes is the #1 cause of non-traumatic amputations. It's not an injury, it's vascular disease. And one of the best explanations I ever heard came from Dr. Arthur Agatston, the cardiologist who developed the coronary artery calcium score. I had the privilege to work with him for a year and went through advanced cardiovascular testing myself. He told me, cardiovascular disease grows in fertile soil. And what makes that soil fertile? Diabetes, obesity, insulin resistance, chronic inflammation, high triglycerides. If the soil is healthy, plaque struggles to grow. If the soil is diseased, plaque spreads like weeds. So during that testing, my CAC score, my heart calcium, was 0. So I had no calcified plaque in my coronary arteries. I did have very minimal plaque in my carotid arteries in my neck, and that became my focus for prevention. He told me, you'll probably never have a heart attack, but we'll manage the carotid risk. We agreed saturated fat was not the enemy. The enemy was insulin resistance and inflammation. Instead of a statin, we tried Zetia first, and I responded beautifully to it. So here's the good news. This process isn't inevitable. Atherosclerosis doesn't have to progress. When we lower insulin, reduce inflammation, and stop bathing our blood vessels in sugar, the body can actually start to heal. That's what a low-carb, ketogenic, or carnivore diet does. It doesn't just change weight, it changes the entire environment of your arteries. These 3 ways of eating lowers your triglycerides, improves HDLs, reduces oxidized LDL, calms inflammation, and protects the endothelium from further injury. You're not just preventing heart disease, you're removing the very condition that allows plaque to grow in the first place. So don't wait for a heart attack, a bypass, or a stroke to make the change. Be proactive, protect your arteries now with real food, low insulin, and a diet that supports the body's natural design. Keto and carnivore aren't a trend. They're powerful metabolic therapies, and your heart, your brain, and your blood vessels will thank you for it. In the next video, part 2, I'll explain the tests that actually matter. CAC scoring, carotid ultrasounds, ApoB, lipoprotein A, fasting insulin, clearly scans, Dopplers, genetics, and which ones to actually ask your doctor for. Make sure you subscribe so you don't miss it.